Hi. Okay, this is a training video for my staff. I'm going to be talking about ketamine in general and what we're finding that it is useful for, and then how we are utilizing it between the two clinics. So we have two clinics that are both providing ketamine treatment. We're going to talk about Great Salt Lake Wellness first. Great Salt Lake Wellness is the therapy clinic that I've had for 10 years. We added ketamine about a year ago. And then Great Salt Lake Medical is providing ketamine infusion treatment. And I just bought out that business in January this month. And we are providing ketamine treatment by infusion at Great Salt Lake Medical. So first, to talk about just an overview of ketamine. So ketamine has been around since about 1970, used in medical settings and the military. So it was developed as a battlefield medicine during the Vietnam War, because it's such a safe medicine and it can be used for anesthetic, for pain, and it's very well tolerated. There's very minimal risks involved, side effects. There's no respiratory distress, things like that. So it's very safe. It's been used in anesthesia since 1970 in surgical centers. And what they found is it actually helps people with mental health symptoms. So they were discovering this over the last 50 years. They started studying it a little bit more in the last 20 years or so. And the FDA finally came out with an approval for one variant of ketamine, the nasal spray. And so now we've been able to use it either on label or off label for the last 4 years or so for mental health purposes. So in Great Salt Lake Wellness, the therapy clinic, what we are doing is we are using oral ketamine, which is called they're called troches. So basically this is the process. The patient reaches out, they're interested in getting treatment with ketamine. And basically now that we own both clinics, we're able to speak with the patient and get to know kind of what is their background with their mental health symptoms, what have they tried before, what are they interested in. Some people really only want to do the medicine, and so working in the infusion clinic might be a little bit more appropriate for them because they're not required, or it's not part of the protocol to have the therapy paired with the medicine at Great Salt Lake Medical in the infusion clinic. But the majority of people are actually going to benefit quite a bit more from pairing the medicine with therapy. And not just any therapy. There's a lot of therapists out there that are wonderful therapists, but you have to get specialized training in psychedelic medicines and psychedelic medicine integration to be able to really help the benefit maximize, or help the patient get the maximal benefit out of the ketamine treatment. So the way we're doing it in Great Salt Lake Wellness is we do the intake. The therapist, myself or one of our CAP therapists, does the intake process, which usually takes 1 or 2 sessions. And then if they are appropriate from a mental health perspective, and we do kind of a general medical screening on them, then we will refer them to one of our providers at Great Salt Lake Medical, who will do the formal medical evaluation and prescribing appointment. Then they will get their medicine bottle. That's their ketamine would be mixed at a compounding pharmacy, which we've got a few in the area that we use. Then the patient has their actual prescription bottle for ketamine that they would then bring into the clinic with their therapist to do their 3-hour CAP session. So CAP, short for ketamine assisted psychotherapy. So then we would follow the CAP protocol, which we would make sure that we have had enough time with the patient in those first couple of sessions to come up with a really good treatment plan of what their intentions are going to be, what they want to be working on in these medicine sessions. Then they are going to have a series of 6 CAP medicine sessions, which are 3 hours long. And then within 24 to 48 hours after the CAP session, they need to have a 1-hour appointment scheduled with the CAP therapist for an integration session. The integration session is done without medicine, where we basically discuss what happened in the CAP session and then everything that they have been thinking about it and processing and experiencing since the CAP session. Because with ketamine, with a psychedelic medicine, you basically have this period of like up to 72 hours after taking the medicine where your brain is more plastic, is what we call it. So more open to experiencing and thinking about different things. Your consciousness is expanded. You're able to look at things from a different perspective. You're able to gain more insights. So that 72-hour window after the medicine is critically important for us to do the integration session and for them to be engaging in as many healthy behaviors as possible, like meditation and yoga, and doing their integration practice that we come up with to help them, or come up with them to be able to implement in their life. Exercise, getting outside, nature, social support, low stress, that kind of thing. So anyway, we do the 6 CAP sessions and 6 integration sessions. And then that's the active phase of their treatment. So we try to do those 6 sessions. You know, the FDA protocol said we needed to get those all done within 2 to 3 weeks, but in practice, we're finding that spacing them out, it's just as helpful. So we kind of work with the patient to determine what's appropriate. And then our CAP sessions can either be done one-on-one, patient with the CAP provider, or the patient can attend the CAP group with other patients, and that's obviously a lower cost to the patient to do it in the group format. However, not every person is going to be appropriate for the group. They might get a lot more out of the one-on-one CAP sessions, but also I think the group sessions are a huge benefit for people because they're able to have the connection with other people, realizing they're not alone in their suffering, which is a huge problem for so many people, that they feel very isolated and alone. So coming into this group setting can help people actually kind of open your eyes in knowing that you're not alone and that a lot of people struggle, and it's okay and it's acceptable and it's encouraged to actually talk about things and get support. So our group has been going really well. We have our Tuesday night group, which is our regular spot for our CAP group, which is open to kind of any patient or customer that might be interested in getting the CAP treatment, obviously, if you're appropriate for it and can get the prescription. Now, I'm also starting a provider-specific ketamine treatment group. So that will be on a different day of the week that I will have open to mental health providers, physical medicine providers, really any kind of like person that's in the caregiver industry would be appropriate to attend the caregiver group. That will be launching in mid to end of February. So I will get everyone the details on that and the dates and all of that. Now, so the infusion clinic provides the medicine. Obviously, this medicine is going to work whether you're doing it infusion or oral troches, because we dose it appropriately based on the bioavailability of that form of medicine. So people are going to get benefit out of doing the ketamine infusions. They're going to get benefit out of doing the oral lozenges. Obviously, they're going to get, in most cases, they're going to get more benefit when it's paired with psychotherapy, either that day or with the integration session within the next day or two. So there might be people that actually really want the infusion and they want like the medical person to be there with them in the room the whole time, and that's completely fine. That person might actually also want to be connected with Great Salt Lake Wellness to get a CAP provider for integration sessions. So we can really use the two businesses to collaborate and to be able to refer to each other based on the patient situation and what they're looking for. And because really there are people out there that really might have more distress if they're talking about everything. You know, some people are for, you know, there's a lot of reasons why people might end up this way, but people that are just quite resistant to talking about anything. And so that's going to be a barrier to them getting treatment because they don't want to talk about it. So that person might be really, really appropriate for the infusion treatment because no one's forcing them to talk about their trauma or anything like that. But if they want to, then we can provide them referrals for the talk therapy integration at Great Salt Lake Wellness or one of our other people that are on our referral list, because we don't need to only refer people to Great Salt Lake Wellness. We can refer people to other providers, other integration coaches that might be closer to their house or more appropriate or something like that. Now, to talk about money. So in Great Salt Lake Wellness, we do take insurance. So we are legally and contractually allowed to bill the patient's insurance for any of the sessions that are not medicine sessions. So all the intake and CAP prep sessions can be billed to insurance. All of the integration sessions can be billed to insurance if the CAP provider can bill that in person's insurance. Great Salt Lake Medical does not bill insurance at all. So for the medical evaluation, prescription appointment, for any of the infusion patients that are doing their intake, and for all of the infusions, Great Salt Lake Medical does not take insurance. However, we can provide a super bill with the CPT codes for the patient to try to obtain reimbursement from their insurance company. And then for Great Salt Lake Wellness, the 3-hour CAP session cannot be billed to insurance. However, we can provide you with a super bill if you would like to try to get your insurance to reimburse you, but most insurances are not reimbursing for that, or they reimburse like a fraction of the actual cost. So the patient would be the one responsible finding out from their insurance company how much of it could be reimbursable. And so the job of the office managers that are receiving these phone calls and emails from people, so whether you're the office manager from Great Salt Lake Medical or Great Salt Lake Wellness, you need to speak with the person and ask them a lot of questions about what they've already done. Like, a lot of people have already done therapy and medication, so they might be like, oh, I don't want CAP because I don't want therapy. I already tried that and it doesn't work. But they haven't tried CAP, which is with provider. I mean, I've been studying psychedelic medicines now for 3 years, and I've gone to all these conferences, read all these books, and then we've been practicing it in the clinic and kind of perfecting the model. So it's completely different than any regular talk therapy that they've ever done. So try not to, if someone tells you that, that doesn't actually mean that CAP wouldn't help them because it involves therapy, because it's totally different. Because basically we're using the therapy and we're using the ketamine as a tool to be able to help the person really combat their negative beliefs or limiting beliefs, or getting through old trauma that they've been really stuck in, that they haven't been able to move through or let go of. So your job as the office manager, or even for our providers. So for the providers, when you actually have a patient that you're treating, you might actually realize as you're talking to them that maybe they would benefit even more by adding another service, or adding, like if you're the infusion provider, maybe referring them to integration sessions the next day with somebody at one of our offices, or somebody, one of our colleagues down in Sandy or something like that. So make sure that you're asking a lot of questions to the patient to determine kind of where they've come from, what their issues are, and then also what treatment could best suit them. A little bit more about ketamine. So ketamine is a psychedelic. I kind of think of it as being like the baby of all psychedelics. I think ketamine has a great utility in mental health treatment, and then also on the infusion side, how it can help with chronic pain. There are other psychedelics that are being researched that will be coming out with FDA approval, or at least with the state program that the legislation is working through currently in the state of Utah, where we might be able to start utilizing other psychedelic medicines legally here in the clinic. However, ketamine is the only one that's allowed right now, and it is very beneficial. It is a psychedelic. It's just not going to give people like a full expansive psychedelic experience like something like psilocybin or ayahuasca might provide, but it is still very helpful, and it's helping people immediately with their symptoms of depression, anxiety, suicidality. But then when we're pairing it with the therapy, it's actually helping people to unleash, let go, tweak, change the way that they're seeing themselves, others, the world, being able to get through old trauma, being able to let stuff go, being able to really kind of shed all the layers that are holding them back and covering them up so that they can be their true, authentic selves. And the last thing I'll say about ketamine, so we do the active phase of treatment, which is usually 6 to 8 sessions. And then typically people do come back for boosters. Everyone's kind of on a different schedule with their boosters. Some people like to have their boosters quarterly, or kind of only when they notice they're kind of really struggling with symptoms again, or monthly. So that would be something that the provider and the patient would need to determine to find an appropriate schedule for the booster sessions.